So one of the most common things we see are patients with peripheral arterial disease. Peripheral arterial disease is going to be caused by atherosclerotic risk factors, generally high cholesterol, high blood pressure. Most commonly puts people at risk for difficulty walking, which is the biggest lifestyle limitation issue. This can span the spectrum from minor difficulty walking longer distances to severe limb-threatening problems, but many of which can be easily identified with non-invasive testing that we perform here at the Vascular lab. Once we have a diagnosis of peripheral arterial disease, we work to identify the location, which can occur basically anywhere from the aorta in the abdomen all the way down below the knees. And here at PCI, we treat a lot of patients with those kind of problems for both lifestyle problems and for limb-threatening procedures. As far as peripheral procedures go, many of these procedures, whether it's angiograms, which can be done at the hospital if need be, or the more invasive procedures such as removing plaque directly from the femoral arteries or bypass surgery, do still have to be done at the hospital on occasion. We are able to mitigate some of the large operations and the longer recovery times by doing endovascular techniques prior to bypass surgery. But for the people who have run out of options and need bypass surgery, they do have to have general anesthesia for that. And typically, with the better anesthetic techniques and experience, people are staying in the hospital for usually 1 to 2 nights after a surgery like that, where we can bypass a very long segment blockage and restore flow to the leg. Bypass surgery for the legs is basically rerouting flow around a blockage which can't be opened from other methods. And sometimes there are anatomic reasons why you don't want to or shouldn't reopen them in that location. But what it generally involves is, in the most ideal situation, is harvesting a vein from the patient's leg and using that as a conduit to attach from an area with good blood flow around the blockage to an area that also has good blood flow. That often involves, a leg incision to harvest the vein, and most often, we tunnel the graft in an anatomic fashion so that you make the distance of your bypass graft shorter, and that the recovery time is then less, and it's away from any possible skin incisions you do have. But much like cardiac bypass, you're just using good inflow from one place to provide outflow to a vessel that didn't previously have direct flow.